Once again, welcome. This is Shaping the Crisis Response System, debriefing on a year of GBRICS community engagement. This is a webinar sponsored by Behavioral Health System Baltimore, and we'll be exploring the community engagement work that we've been doing over the last year in support of the efforts and initiatives around the GBRICS partnership. My name is Dan Rabbit. I'm a policy director who's been working on the GBRICS partnership and other behavioral health crisis response services and issues related to that. As folks are joining, please feel free to put your name and organization in the chat so we know who we're spending our time with this evening. And thanks again for joining us. Our agenda for tonight, we're scheduled for 2 hours. We'll see if we need that whole time, but we wanted to make sure to have enough time to kind of explore all the different facets of what we've learned and what we've been up to over the last year. I'll start with some introductory information about GBRICS, the Greater Baltimore Regional Integrated Crisis System, and then be passing it over to my colleagues here at BHSB to talk about what our community engagement work looked like over the last year, both what we learned through the efforts that we've engaged in and how those insights influenced the decisions that have been made so far with the GBRICS funded services. We'll then transition over to a panel discussion with community partners who were a part of some of our community engagement events and participated in some of our community engagement events, and that we'll hear from them about like what was important or meaningful in their experience. And we'll also have some opportunity for attendee questions at that point. And then we will wrap up with a discussion of what our community engagement work is going to look like going forward. Now that we've been doing it for a year, and some of the new services are going to be coming online this year, and with the new 988 crisis and suicide prevention lifeline launching next year. So that's the plan for the webinar, and we're happy to have everybody. So to start, mentioned it a few times already, but all of this sort of was inspired by the GBRICS partnership. And so my guess is a lot of folks here are familiar with this initiative, but just to make sure we all have a baseline understanding, wanted to share what this is. GBRICS stands for Greater Baltimore Regional Integrated Crisis System. It is a 5-year, $45 million initiative. It was funded by the Health Services Cost Review Commission, which is a hospital funding entity here in the state of Maryland. And the initiative came about from a grant that entity put out to solicit proposals that would use the Crisis Now model to augment existing behavioral health crisis response services to better serve folks in Maryland and ultimately save hospital dollars in the long run. The partnership consists of those 4 jurisdictions that you see on that map there: Baltimore City, Baltimore County, Howard County, and Carroll County. All 17 hospitals in those jurisdictions signed on, as well as local government and local behavioral health authorities. And BHSB serves as the regional administrative manager. So we are coordinating all of this work, bringing people together to make decisions on how these services should be, like how the GBRICS partnership should go about achieving its goals. The overarching goal of this partnership is to fund new services with the goal of reducing unnecessary emergency department use and police interaction for people in behavioral health crisis. Far too often, if somebody is distressed, is feeling overwhelmed, is having suicidal thoughts, is emotionally unable to handle things, they turn to 911, and that will lead to an ambulance ride or a police ride to the hospital. In that setting, doesn't serve people in emotional distress particularly well, and it also is very costly to the system and can lead to negative outcomes for the folks who were calling for help in the first place. So we want to move away from that. And the GBRICS partnership is trying to do that with a regional approach in those 4 jurisdictions and through funding the elements that you see, funding and pursuing the elements that you see on the screen. The key elements is establishing a 988 regional call center, which will serve those 4 regions and receive calls from the community, from people who are seeking behavioral health support or are in intense distress. But this new call center will also have sophisticated software that will allow for better dispatching of services and better coordination of like immediate and follow-up services to help that person stabilize and overcome what's distressing them. Another big piece is expanding mobile response teams and standardizing the services and expectations of those mobile response teams. The third big service-oriented piece is open access, which will allow people in urgent need to get same day or next day walk-in or virtual appointments when they call the 988 Regional Call Center. And we'll be working with dozens of community behavioral health clinics to provide those open access appointments. And then the fourth big component, and a lot of what we're going to be talking about tonight, is community engagement and outreach. We recognize that funding new services and expanding access to services is only one piece of the puzzle, and that we need to really change. We both need to raise awareness of these new services and their importance, as well as change, help create a culture shift for people who are used to calling 911 and relying on the emergency room for urgent needs to consider calling the 988 Regional Call Center or similar crisis services. At the same time, we also know that we don't know always what's the best way to provide services in any given community, and that we really should be partnering with community residents as we're launching these services and designing these services. And so that led us to really prioritize community engagement as a key component to the initiatives that the partnership is pursuing. Samira and my colleagues will be talking about how that took shape and what we learned from that in just a moment. The last element I'll mention is nonprofit multi-stakeholder oversight. And that's that BHSB is convening and coordinating all of this, but there is oversight from a variety of partners, both like institutional partners, but I would also say community partners. And we really want to make sure that this is being done right and that we're achieving the impact that we want to see happen. So those are the elements. Just want to get make sure everybody knows what we're talking about to a degree. A lot of what we learned through community engagement relates to these different services that we will be strengthening and expanding over the coming years. And so thanks for humoring me to go over that with all of you. And with that, I'm going to pass it over to Samira Abdul Fattah to introduce herself and share how our community engagement work really took shape and what we learned from it over the last year.
Thanks, Dan, and welcome everyone. We're so glad you could join us this evening. Next slide, please. I picked these 2 quotes because they really speak to community engagement, in particular, how we feel about engaging the community and what we've tried to accomplish. I particularly like the first one because it describes that for us that we have to respect the community. It also means that we listen with specific focus on what the community has shared with us and continues to share with us, and when possible, incorporating that feedback into implementation. The second quote really holds a special place for me. It was from a roundtable that we did towards the end of the sessions. And I really was touched by what this individual had to say. He was a member of the LGBTQ community. And I was just very thankful and grateful that he felt comfortable sharing the story, his story, and that he shared this quote at the end. Next slide, please. This is our initial community engagement plan. You know, we established the community engagement community and local subcommittees. We convened a working group over the summer of last year to develop a plan to obtain community input. We identified target groups, diverse population, and partners. We conducted over 27 community roundtables. We could not have done that without the help of the Community Engagement Committee and without the help of the local subcommittees. People really stepped up. They helped us a lot. We were very, very grateful for their help. And they also put us in touch with others as well. We analyzed the community input and we incorporated, where possible, your feedback into the implementation and the decisions regarding implementation. We published an interim and a comprehensive report. We're holding this forum, and we are also planning future opportunities to stay true to meaningful community engagement. And I just want to take this time too to make a special plug for the report. If you haven't already done so, please read it. There's a lot of information contained in there, and you won't be disappointed. It's very good. Next slide, please. The results: more than 258 people completed the survey. We had a small population of Spanish-speaking people who completed a survey in Spanish. We had over 325 community residents who participated in roundtables in the 4 jurisdictions. They were very honest and candid in their dialogue. And as we mentioned before, we continue to expand our outreach with key community leaders. Hold on 1 minute. Sorry. Next slide, please. These are the 12 community engagement themes. Earn the trust of the communities and overcome skepticism. Provide dependable, timely, safe, and helpful services. Require high quality training. Coordinate access to other services, especially follow-up. Ensure that the services are inclusive and culturally representative. Reduce the reliance on police for behavioral health crisis response. Next slide, please. Combat pervasive stigma. We want to continue to educate the public on what to expect. Integrate community partners into the crisis system. And we also want to think upstream to prevent crises. We want to make the most of technology and to clarify insurance and payment issues. Next slide, please. These are the highlights and insights from the community engagement report. We know that community engagement is essential. We know that communities want to be active partners. That was very clear from the first roundtable that I participated in. They want to develop those relationships over time. We don't want it to be a one and done. And we want to routinely host events over the course of the project because we want to remain in touch with people. And we want people to share with us their experiences as the various components of GBRICS are rolled out. Also, we've partnered with trusted leaders, community leaders, and organizations. The 2 quotes on the side already describe, we already talked about communities know what they need. And also the last quote, we need this beautiful care. When in crisis, you need to know that someone who cares is coming to help. And we want to stay true to that. Next slide, please. We also learned specific communities need tailored strategies. We should be using peers whenever possible. reaching youth is critical. Youth have described to us and explained to us how important word of mouth is to them, and that they need people that they can trust and that speak their language to refer them to services. Reaching young men, we understand and continue to find ways to engage them, especially overcoming stigma and hesitancy, and that parents have a unique perspective and want to be involved. When reaching youth, we found out not only word of mouth, but also I mentioned that peers is very important to helping them access services. We also found that was true in the African American and Spanish speaking communities. Young men, I can recall 2 examples of where reaching out to young men and being able to get them to see, and maybe also to address some of the stigma they may have had around accessing services. One was a young man in South Baltimore who worked with young fathers. And he explained to me during our conversation that often the young men that he worked with didn't see accessing mental health as one of the things that really spoke to them. And when he would try and approach them, they would say, no, man, that's not for me. And he said, he started speaking up and telling them, yes, it is for you. There's some specific messages in here that, could help you. There's services that could help you. But mostly he invested time to make sure that they understood that, yes, this did speak to him. And then we had another young man who participated in a roundtable towards the end of the session. And he recalled a very unpleasant experience with a family member, and they had to call for additional crisis response, and law enforcement showed up. And he said that his family member ended up incarcerated. And another colleague from BHSB was with me at the time. And, we spoke to him, we told him about the services. And at the end of the session, he said that he would be willing to give us, another opportunity. If his family member were to experience that same situation again, he would call for help. We also found that parents have a unique perspective and that they want to be involved. Many of the parents, especially in the developmentally disabled community, spoke to the challenges and difficult situations that they encountered with their children. They often spoke of a constant cycle of, their child or the young adult was in crisis, having to call law enforcement, or either taking them to the ED directly, bringing them home, and only to repeat that situation, sometimes again that same evening or shortly thereafter. Members of the LGBTQ community spoke of having to deal with people who were disrespectful towards them. They said that they, might have a great clinician or a therapist, but first they had to get through that front door. And that was very difficult for some of them. And then our roundtables with members of the immigrant community, they spoke to also the challenges of not having documents in translation available, and then translation being considered as an afterthought for them, and how they felt that that was very disrespectful. Next slide, please. Crisis moments are vulnerable moments. That was repeated throughout the roundtables. Those 2 quotes on the side really do speak to that. One person said that they have worked in the mental health field and they know what a difference a phone call can make when a person is in crisis. And then the other response from one of the participants, that all responders need to know that the person in distress is very vulnerable. Forceful or embarrassing treatment can have a lasting negative effect. So as you can see, people have been traumatized by providers and by the response from the police. We've had a couple of parents really shared their stories that about their children being tackled in 1 or 2 cases by law enforcement and first responders. And that experience not only was very traumatic for the child, but also for the parent, because the parent felt that they were judged to be a bad parent. Others who are young adults now spoke about being humiliated and disrespectful by first responders. That sometimes led to embarrassing treatment. One young man recalled being drugged through the hall of his school and how embarrassed he was in front of his peers. And then another young man mentioned that, excuse me, he felt embarrassed by his diagnosis. And if his peers knew anything about his diagnosis, they probably wouldn't want to be friends with him. And that was really a source of concern for him. But he also spoke to the high quality services that had given him a lot of hope and also had helped him quite a bit. People shared the importance of training, education, and cultural sensitivity, how crucial that was. The training, especially on the part of first responders. Some people spoke about how helpful that training. They felt it was very helpful because the police and other first responders were very professional. They were very polite and they were very helpful with them. And they could tell that they were well trained. High quality services, we know, is very important to people. People shared with us the experiences sometimes of having to travel quite a distance and the quality of service from the provider not quite being what they expected. So we felt and feel very strongly that training, education, and cultural sensitivity is crucial. These were just some of the stories that I shared with you. You will definitely hear more from the roundtable this evening. And again, I want to encourage you to read the report because it's, like I said, very powerful. And if you have any questions, I will try and take them now.
No questions so far, Samira. I think just passing it on to Shauna.
Okay, all right. Passing it on to my colleague, Shauna Brock, and she will talk to you about the standards and how we incorporated the standards.
Great. Good evening, everybody. I'm Shauna Brock. I'm Director of GBRICS Implementation, and I'm just going to talk to you a little bit about how we have, as Samira said, how we've incorporated feedback from community engagement into our implementation of the programs. And I'm going to focus mostly on the GBRICS crisis system standards because that's really kind of the structure and the framework to what we're implementing. And it's also something that you can refer to see how we've incorporated the feedback. So those standards the work on that started at the same time as the community engagement work. We convened a mobile response team work group over a course of 6 months, and we had a good group of people that worked on that, representing community members, people with lived experience, representatives from the existing service providers in each of the jurisdictions, and also staff representing the local behavioral health authorities, which is the agencies that are tasked with monitoring and managing the behavioral health system in their jurisdictions. Next slide. So the standards were based on a lot of different information that we pulled into one document. And we started with the group by coming up with shared service values. And we also did a lot of work, a lot of research on national best practices. And I'll also mention the reason why we focus so much on creating these standards is that there are no state or regional or national standards for mobile response teams. There are standards for call centers, Lifeline call centers that work with people with behavioral health issues and suicide prevention, but there were no standards for mobile crisis response. So that's what we focused on. There were lots of best practices, so we brought those into a document. We also did an environmental scan of what is already existing in our region. We got a lot of feedback on those drafts and a lot of feedback from the Behavioral Health Administration. And and what I'll talk about tonight is how we incorporated the feedback from community engagement activities. And we kind of did that as we were going along, as we were getting feedback. And then at the end, we didn't finalize the standards till we were finished with our community engagement work. All right. The reason how we're going to use the crisis system standards is to provide greater consistency with the implementation of crisis services across the region, an expectation of quality, and improving accountability. So really consistency, quality, and accountability are our main focus. We will be creating a structure for regular public input into the crisis system and review of the data that we'll be collecting. So that is really one of the things we'll be working on as we implement those services. We've already used the crisis system standards as the basis for evaluating competitive bid for our services. So we have put out competitive bids for mobile response services, for the call center, also for open access clinics. And then we'll be using the standards to audit those providers as we go along. Something that's new in our region is a model that incorporates a clinician and peer. It is a model that is in some of our jurisdictions, but not all. And so we focus a lot on having figuring out how we can incorporate peers into our work. And we want to make sure that we have consistent, high quality services that can operate across jurisdictional boundaries. And that'll help us have a faster speed of response to crises. Next slide. Yep, oh, there we go. So I put the link to the crisis system standards in the chat, and there's a lot of detail in those standards. And as they say, devil's in the details. So please take a chance to dive into those if you're interested. But I'm just going to talk a little bit, a very high level of what's included in the standards. So our aim is to have services available 24 hours a day, every day of the year. And we are working on building that out where that doesn't exist already. We are working on integrated services available to everyone. So everyone throughout the lifespan, everyone regardless of insurance or immigration status, and also looking to serve special populations as well, such as the developmental disabilities community. So our service competencies are also pretty detailed, but the basis of that are universal competencies, which are welcoming, hopeful, safe, trauma-informed, and culturally affirming. And that relates to our training standards, which you'll see on the next slide. We have a timeliness standard, and that aligns with what Behavioral Health Administration is creating as their standard, which is for mobile response teams to respond within 1 hour. We also have a follow-up standard, which is within follow-up calls within 72 hours and continuing with the person that was in crisis until they're connected to care, or up to 3 months. As I mentioned before, system accountability is very important. So we have standards regarding system accountability and how we're going to build that out. And then standards around collaboration. So how do crisis service providers collaborate with the rest of the behavioral health system? Next slide. There we go. And then we have practice guidelines. Again, these are very detailed, but some of them I'll talk a little bit about on the next slide. We have expectations that crisis systems effectively engage with families and other supports. We have standards around emergency petitions. So emergency petitions are when a person is engaged involuntarily and taken to the hospital for evaluation. We have standards around working with children, youth, and families, around language access, and serving the deaf and hard of hearing population. We also have standards around staffing and around training. And the training standards, I urge you to take a look at it. They're very comprehensive, based on a lot of feedback that we received through the community engagement work, and as well as from the work groups. There was a lot of emphasis on training. Next slide. So I have a few examples of how, pretty concrete examples of how we use community engagement feedback and incorporated it into the standards. So as we receive feedback from community engagement, then we researched what are the best practices in these areas to really flesh out how we can put that feedback into practice. So 2 examples. One is we heard a lot of feedback around the need to effectively engage with families and other support systems. And we heard feedback that that wasn't always done in a way that was supportive to families. So we researched what the best practices were regarding that and put in our standards. And really to regard the family and other support as priority customers. So just as much of a priority as the person in crisis. And then around emergency petitions, we put standards in place to monitor the use of emergency petitions so we can see when those are used. And then also some language that requires the teams to use emergency petitions as a last resort. Next slide. And so in cases where we didn't really find best practices that would align with the feedback that we received from community engagement, we decided to pilot those changes. So one example was how do mobile response teams respond to third-party callers? So that's a situation where someone is calling about another, about someone else. So the person in crisis isn't calling someone else, calling on their behalf. And we wanted to figure out how we could improve that. But we didn't really find a lot that was in the way of best practice literature. So we are having a mobile response team pilot, and that's one of the things that we are going to pilot is improving that. Some other feedback that we got is that mobile response teams, some of the jurisdictions transport people who want to go to care voluntarily, and others don't. And so we decided to put that into a pilot as well to figure out how we can improve that. So I think that concludes my section, and I'm gonna pass it off to Dan, and he's gonna talk to you about how we incorporated community engagement in, oh, I have one more slide. Oh my goodness. Forgot about this slide. And I saw Dan pop up. So one thing that we got a lot of feedback around, but we weren't really sure how, we just needed a lot more information, was around when law enforcement should respond, when medical teams should respond. We are trying to reduce the use of law enforcement, but we do know that law enforcement is still required sometimes. And so we really want to set out concretely so there's more transparency and accountability around when law enforcement responds. But in order to do this, we need a lot more feedback. So just last week, we had a community forum, and which included representatives from law enforcement and 911, emergency response, people of lived experience, our local behavioral health authorities, and our existing providers. And so we had a forum where we gathered input on the framework that will shape how mobile response teams are deployed. So we spent a lot of time discussing crisis scenarios and identified the types of teams that should respond to specific situations. And this information will be compiled and reported back to the community. And we're really hoping that this will help us with our upcoming pilot when we are going to try out some of these ideas about changing who responds to different crisis calls. And now I will turn it over to Dan. Thanks, everybody.
Thanks, Shauna. And I know you gotta jump off. So we did have one question come through on the chat that I thought maybe you could touch on before I go over my slides, which was, can you give an example of a service competency and how clinicians are assessed? And maybe more broadly, just like how are we going to hold folks accountable to the standards that you outlined?
Yeah, that's a really great question. In terms of a competency, I don't know if we well, the universal competencies I mentioned are welcoming, hopeful, safe, trauma-informed, and culturally affirming. And in terms of the how we will hold, I don't know that we necessarily, as a local behavioral health authority, are going to be holding individual staff accountable. We'll be more holding the agencies that hold the contracts accountable. And the way we'll do that is through auditing and through consumer feedback and through our system-wide accountability structure. And we're still working on building that out next year, but we're going to have a lot more data, and as well as consumer quality data. And we'll also be looking over case reviews and sentinel events. So sentinel events is when someone is injured. So we're just going to have a lot more transparency with the system in general. And I'll be here at the end for questions as well. I might have to jump off and get back on again, but I'll be here at the end. Okay,
thanks. Yep, and keep those questions coming. We're not going to stop and answer them all in real time, but we definitely welcome questions, and we'll have like a question period in the middle of the webinar and then at the end as well. So let us know if folks have other questions. You can put it in the Q&A box, or we're monitoring the chat as well. So like Shauna said, the standards and the program design of the changes that are coming due to the GBRICS partnership are one way that we incorporated feedback. And there's a lot more information about all the different kind of things that we heard and how they're reflected in the decisions that were made. That's in the community engagement report. That was put in the chat, and it's on our BHSB website. But another really important aspect of the work that we're doing is our outreach and education campaign to help raise awareness of these services and encourage help seeking. And so we incorporated community engagement a lot in that campaign design as well. The feedback that we received from the roundtables and the BHSB online survey that Samir mentioned was shared with our marketing firm, which is Marketing for Change. And then they took that information and did their own comprehensive market research that polled and interviewed residents across the 4 jurisdictions. They did their own like longer, more quantitative and like rigorous survey with over 700 residents, and they did in-depth interviews with 60 residents and met with a number of our key partners, maybe some of the folks on this call. So that, that marketing team and in our consultation with them really used community feedback in crafting messages and designing what a campaign could look like. And the campaign, some of those like kind of overarching themes of it are that we want to roll out in phases so that we do not overpromise and underdeliver. That was something that came through loud and clear, is that if people are expecting a certain service or a certain level of access, and then we fail to deliver that level of access or that service or that level of quality, that it's very hard to win people back over to give the line another chance. And so phases, a phased approach of marketing and public education is one way to address that. We want to help people to understand what to expect when they call 988 or a crisis helpline. And that was a big barrier that people said, is that they didn't really understand how the system worked. That made them hesitant to reach out when they were in need. And that we wanted to normalize that everyone needs help at some point. That it's a very rare person that doesn't need support from at some point. And so we want to kind of break that stereotype that asking for help and needing to access mental health crisis services is like a sign of weakness. Some of the campaign messaging that we heard is that there are some key language lessons that we learned around avoiding kind of negative language like crisis and struggle, avoiding overly clinical terms. Behavioral health in and of itself is not a well understood term. So being much more tangible, talking about feeling down, feeling overwhelmed, feeling sad, as opposed to clinical terms or other jargon. And that hopeful language, positive language that describes the act of seeking help as brave or courageous. That language would be much better. And then kind of like an overarching thing that we learned also was that the community or that the various communities that exist in the region need to have messages that are tailored to them, and that it's going to be hard for us to know exactly what those messages are. And so we should coordinate with and partner with trusted leaders that are already in those communities and understand those communities better. They'll like that communities have different manifestations of stigma, different backgrounds, different relationships with the public behavioral health system, with mental health services, with law enforcement or hospitals, and that needs to be taken into account. And so that information was incorporated into our plans for an outreach and education campaign later on. And I'll go a little bit into what that campaign looks like after the panel discussion as we're talking about our next steps, because implementing that campaign is a big next community engagement step for us. I do see one question that I can address before passing it along. That's how you plan to incorporate private practice community. We did send out the survey far and wide, both our community engagement survey as well as the market research survey, and we very much appreciate the breadth of people who answered that survey. And engaging private practice, engaging hospital partners, engaging schools, engaging different stakeholders is definitely part of our plan, but we're still kind of in the process of launching that plan because some of the services that we mentioned that are supported by GBRICS partnership funding, as well as the new 988 number, they haven't launched yet. And so you'll be seeing more opportunities to be a part of this outreach and education campaign as well as resources to help support in different provider types in the coming months. But we'll touch on that a little bit more later on in the webinar. For now, I'm going to pass it back to Samira, as well as a great panel of community partners who participated in some of these community engagement activities and helped to plan them, to have a discussion about how this process went for them and what they learned. Samira?
Thanks, Dan. And I just want to concur with Dan. We have a great group of panelists, and we really want to thank each and every one of them for agreeing to participate tonight. And I'm going to ask them to introduce themselves. We will go in alphabetical order. We will start with Brian Johnson, and then he can tell you a little bit about himself, and then he can introduce Carlos and take it from there. Is Brian available?
I don't see him.
I don't either. Well, Carlos, why don't we start with you since you're ready?
Good evening, everybody. First of all, congratulations, Samira and Dan. I know we were probably hoping for a larger turnout, but it's interesting when you do brand new initiatives like this. A lot of times they have to gain some momentum, if you will. And it's not because of the work that you guys have been doing. So I'm the program director over at Dee's Place, at least for another 24 hours. And then I'm going to step away from that position, do a little reassessment, and not necessarily reinvent myself, but come back again strong. And I can see me working on some of the GBRICS stuff, especially as far as educating the community, also holding the system responsive. I'm one of these people that says, I've looked at this thing. We over at Dee's Place helped convene one of the listening sessions back in January. I specifically reached out to my network of people in recovery and community folks and asked them to chime in and to weigh in. And so my thing is, in theory, this is going to be an awesome system. But just like any other thing, it's going to have its hiccups and it's going to have its growing pains. Questions that I had, like, hopefully families and people or even law enforcement aren't going to weaponize this to try to hold people not accountable. What's the word I want to use? Hold this against folks. One of my big concerns also is that when we talk about GBRICS and we talk about behavioral health, there seems to be this strong tilt towards mental health. And I want to make sure that we're talking behavioral health, because a lot of times folks that are involved in substance use disorder, or they're in crisis because of because of using a substance, there's this underlying mental health issue as well. And I don't want it to just be minimized. Oh, they're a person on drugs. I'm going to step back for a minute and just let some of my other panelists jump in, and then I'll join and be a part of the conversation.
Hello, I am Crystal Simpson, Senior Family Peer Support Specialist with Maryland Coalition of Families. I am I provide support as well as resources for the caretaker, which could be mom, dad, grandparent, foster, mom or dad. We provide the peer support. So I am also a mom of 3 children that all have a mental health diagnosis, and has had a lot of experience with the mobile crisis, the police, and the emergency room, as well as a few of the hospitals in the area that he was sent to. So in my job, I have a lot of access to partners and families, because that's all I deal with is families and other moms and dads that have the same issue that I was having, and I help them navigate the system. So they report back to me how it worked for them or how it didn't. And I was able to gather a lot of information and provide it, which was amazing because it starts in the community with the families and the youth or the adult, the loved one that's being affected. So, and I'm so grateful for the invitation to be here this evening.
Hello, everyone. My name is Selena Harrington. I live in Baltimore, and a lot of my time and work is really focused around connecting communities and institutions in order to develop solutions to common challenges. And a lot of my work now is focused on working both in the city and out in the county. And I wanted to highlight a couple of things and the reasons why I'm excited for GBRICS and 988. Part of the work I do is in a community called Market Center at the core of Baltimore. And it's around the revitalization of Lexington Market, which is a historic market, an icon for Baltimore. And it's a wonderful place for food access, for folks coming together and gathering. But it's also a place where a lot of folks who come together have a lot of different needs. And folks there are struggling a lot of times with active addiction and mental health challenges. And the community of Market Center really wants to find a way to support those individuals in a way that it provides them the support that they need. And 988 is a great resource, and folks are excited about it coming to the community because what they've seen in Market Center is folks who have been dealing with challenges either had to go to the emergency room or they were having encounters with police. And like Dan mentioned, those outcomes usually aren't great for the person or for those systems. So 988 is a great resource. The second thing I'll say is I've been working with organizations actually out in Anne Arundel County. And that community has experienced a lot of challenges dealing with mental health of young people. And one of the communities we were working in, we actually had that community, a young person, die of suicide. And it not only affected the family, but that entire community and that entire group of young people that was connected to this young person. And I thought to myself, this is something that affects all of us. And if there was a 988 that folks knew about, maybe that young person could have gotten help. And I think about all the other young people who are struggling with mental health challenges now. So I'm just so excited to be part of this process and to connect this resource to community.
Hi, everyone. I'm Tina Jones, and I am Programs Director for Free State Justice, and my pronouns are she and her. As Programs Director for Free State, one of the projects that I work on, in addition to GBRICS, is actually helping to establish a community navigator program throughout the state of Maryland to provide better access and quality of services for the LGBTQ community, specifically around healthcare, both physical and mental health. I also serve as a chair of a board of a Pride Center in Maryland, and I run a transgender support group too. Also, personally, I am a suicide survivor, so I understand personally, how folks feel, having been there, having accessed the system, and understand how the system works. I also, unfortunately, was the foster parent of a child who just lost her life to suicide 5 weeks ago, a non-binary child who was afraid to access the system. So I know the benefits of it. I also know the shortcomings of it, and we need to reimagine this system. We need to redesign it, and the work that's being done here is so important for so many people. And as Pickett just said, the youth are especially vulnerable here, and we need to be really working for them.
Hello everyone, I'm Zion Pittman. I attend Western High School as a rising senior. I'm 17 years old and I'm also a Healing Youth Alliance ambassador. I'm sorry my camera is off. I've just left from filming a documentary for our Youth Food Security Network team about food insecurity. So yeah, it was really exciting doing the focus groups as a roundtable talk. Just hearing the different youth perspectives and things like that was really interesting and really engaging to how we can change the city as youth, speaking from a youth perspective. So it was really good getting that perspective from youth living in Baltimore City.
Well, thank you all for those introductions. They were very moving. And I want to hold up all of you. And I want to thank you for attending and participating tonight. And I want to send a special hold up to Tina and Pickett for what they've shared. So we're going to start. I'm just going to ask you a general question and you all can chime in. From your experience, how do you see GBRICS helping you? I think you've described, some of you have described that, your family and the community. I think we'll start with Crystal.
Thank you, Samira. Personally, I think that it will help. You know, I had a son that had a lot of destructive behaviors. He had something called intermittent explosive disorder, along with depression, severe anxiety, and some other things going on. And this number, and from the input from everything, it does focus not only on adults and even seniors, but it really takes a dive into the youth and providing them with an alternative to the police, you know, with having specially trained officers that are, you know, involved with mental health, mobile crisis teams that are more available, and just the way that they'll handle him. It won't be so scary for him if he was to have a next episode. He may not end up in jail, but now that he's 20 years old, that could be a possibility if someone comes and doesn't know what is going on with him. So I think it'll be a deterrent for that. So personally, as his mom, I think that this is definitely going in the right direction, and it's providing a lot of alternatives professionally. And from what I know from my families, they have those challenges, the same ones that I do. And they just need better trained, you know, officers in mobile crisis and, you know, directed specifically for mental health. I do support one family that has an adult child that I know would prefer this, because he was very intimidated by the police and calling 911. And because as being an adult, it's really hard to admit that you're suicidal. And it was, he took himself right to an emergency room, and it was hard for them to contact his parents because he's an adult. And it was so much harder. So if he had this number to call, and his parents had this number to call to find out what the process would be, or how, you know, some other resources, that would have been great. I think it'll be very comforting to some of the families. I know it'll have its challenges, but in the end, I think that, you know, the community, the families, even my life will benefit from this.
Yeah. Open it up to our other panelists who would like to chime in.
I want to echo some of what Crystal said. I mean, in the LGBTQ community, there is a general distrust of law enforcement because, unfortunately, our sexual orientation and gender identity is often used against us. That's especially true for transgender women of color. So there's a need. Some of the things that we've heard was, you know, the need to really transform, as I mentioned earlier, and just create a system that's different than prior experiences, but also one that reflects our community. You know, so that we meet people, we talk to people who share lived experiences that we've had. And so that's so very important.
I'll share a little bit from a community perspective, and especially in the communities that I work with, you know, primary communities of color. And there is, you know, unfortunately, mistrust of police. And a lot of times communities feel like, you know, they can only call the police, right, 911, to get support that they need for someone. So to have an alternative, you know, number and a mobile crisis team to call 988 and know that folks can kind of get the support and help they need, I think is important. And I think also police have been clear too. It's like, you know, we shouldn't be doing this, right? And we can't do it. So I think that's another reason too, while I think the timing of this is right and the communities are ready for it. And the last thing I'll say is, a lot of times folks see people in crisis and don't know them personally, right? A lot of times folks are calling because it's a family member or friend and they know that person, but a lot of times they don't. So to have the ability to reach out to someone on behalf of that person to get them help is going to be important as well.
I definitely agree with, I'm sorry, Mr. Slater Harrington. I think that the communities are ready for this. And as, like he said, it might be a person that you don't know. It could be another student. It could be your neighbor, you know, it could be, you know, someone on a support group or someone you met. I know that I've attended a few with some of my youth that, you know, just attending with the mom so the mom can, you know, understand what's going on with the support groups that, you know, he attends. And it is an LBG, I'm sorry, an LB, I can't get it out. I'm so sorry. Tina, help me there.
LGBTQ.
Thank you. I couldn't get it all out. I'm so sorry. But she had a better understanding of that. But then they also could see that they were strangers and, you know, they wanted to know how to help if something happened. So I think this will give them an outlet to do that.
I have to agree with all my co-panelists. I'm also, like Pickett was saying, you know, discussing or talking about or the issue of mental illness within communities of color is sort of like taboo for sure. It's something we don't talk about. At these places, we do peer services in addition to other services. And like I said, I've been there 16 months and I can only remember one time where we actually encountered a member that was in what I would term a mental health crisis. And we're connected literally with a behavioral health program next door to us, and we refer to them for mental health services. And there was a gentleman that had escalated while he was on that side of the building, but had a close relationship, Pickett, with the peer that we were working with. And it was something as simple as he thought somebody had stole something from him in a house that he was living in as part of the program. And it escalated to the point that the police were called. And I would say good part was the police recognized that he was in crisis. And so handcuffs coming out weren't the first thing. They tried to de-escalate. They tried to talk him down. We utilized the peer who he had the relationship with, and we were able to get him calmed down enough that instead of going to central booking, he went over to Johns Hopkins under observation for a while. And then we were able to get him the help. So in the case where first responders are trained in, like, your first response isn't lock them up or put the handcuffs on them or something like that, that this is a behavioral health issue, and that we have services that can help somebody like that. And like I said, in my case, it's just that most of the folks that we deal with, Tina, are probably going to be presenting with substance use issues, but underlying there's some mental health. And so I hope they don't get categorized or pushed over into a, not worthy of our time there, because in my experience, because I'm a person in long-term recovery, that in most cases, there's always some underlying trauma that is in a lot of cases undealt with. And so I'm hoping that, GBRICS, this whole system in place, we can begin to deal with people in a more human manner than incarceration or punitive wise.
Well, thank you all. I also wanted to ask Zion, would you have anything that you would like to say?
Yes, I would say, for me, I would say that GBRICS will help, because I know my family, especially a close sibling of mine, struggled with mental health a lot, and it wasn't really many resources for her when we were younger. So like, it would just be the police van called, and I don't think that was the right response when it comes to youth, definitely in Baltimore City, because we usually see police as a threat or that they did something wrong, or simply, I just feel like, you don't understand mental health, you can't control like what's going on. So I feel like if GBRICS was a thing put in place when she was going through her mental health problems, it would help, because you'll have the right responses rather than having someone with a gun and a taser pointed at you because you're just having a mental health crisis that no one can understand. So I just think it will help, like, youth period, definitely in Baltimore City, with experience a lot of violence and aggressiveness towards them, because we stay, like, my dad stays in Prince George's County, and they were just saying how a lot of encounters when it comes to Baltimore City youth, they are really come off really aggressive when people are trying to be there for them. And I just thought I was like, wow, like, we do, because of simply lack of resources compared to other counties, even in Maryland, other states and stuff. So this start right here will help, like, a lot of, like, addressing things when it comes to school, maybe even people graduating high school more. And then just understanding themselves more and their family, because I know it can help with them having the right responses to mental health crisis.
Thank you, Zion. Really appreciate that. My next question is, in Baltimore, and kindly correct me if I'm wrong, there's been a history of organizations trying to implement programs and coming up short. How does GBRICS compare to other projects that have come along in the past? And I'll ask Carlos to kind of lead the discussion.
I think in a lot of cases, Samara, it has to do with sustainability. You have these great ideas, you have a lot of energy on the front end, and then because you can't find sustainable funding or something like that, or I was just on a Zoom call earlier where they talked about the next big initiative or what folks are interested in. So it's like longevity. If this is going to work, it's probably going to be because GBRICS has developed a relationship with the community, and the community has built trust. I always equate it to the sports analogy. We love our Ravens and we love our Orioles, but that was over a period of time. And we can learn to love our treatment system, and we can learn to love GBRICS too, but it has to be responsive, and if it's not, then people won't, they won't utilize it.
I also want to add to, I think, along with what Carlos said, is that this is a multi-sector approach. By sector, I mean you have government, you have nonprofit, you have for-profit, you have community. And I think that's essential to when you're trying to address a complex issue such as this, right? You have to have everybody involved in it. And if you look at GBRICS and 988, like, it involves all those different sectors working together. So I think that's something else that makes it unique.
I would have to agree with Mr. Harrington. And I was going to say something similar, that everything before was in silos. Like, here's the providers, here's the nonprofit, here's the community. And it was really difficult to get that wraparound approach with a family because nobody communicated with each other. And they were getting a lot of repeat services that weren't needed. So it took extra time to get them directly to the help that's going to help. So this will allow them to have better communication. It's, it'll all be in one central area, and it'll build those connections between the providers, the nonprofits, and so on. So yeah, I think it's going to prevent those silos as much and really connect everyone.
The other thing I would add, and it's evidenced by the focus groups that have been held, so many systems get put out without actually getting the community feedback. And we talk about community, but we forget all the subsets of the community that have to be included. And how many focus groups do you said you have held so far, Samira?
We've held over 20, about 27.
So that's my point. Usually folks will do, maybe 1 or 2, maybe a handful. You've done 27 over a period, quite an extended period here, to make sure that, the planning that's going in here is necessary, and it's hearing the voices of everyone who could be potentially impacted. That's one of the critical elements to success.
So in the sense that GBRICS, I believe, is a 5-year initiative.
That's correct.
Okay, and the question is, what has to happen so that the 5 turns into 10? Is it that it has to be overutilized, or it has to be utilized to a max, or it has to be we had to find funding somewhere? I mean, we know how this first round of funding came, but is this something that our elected officials, or is this something that we can codify in legislation so that this money is going to be there? I mean, it would be a doggone shame if we build GBRICS up and it becomes super utilized over 3 years or 4 years, and then we spend the last year trying to figure out how we sustain it.
I'm glad you raised those questions, Carlos, because Dan is going to talk about them in a few minutes, but we have already started to work on some of those, and they were, some of that work began during our planning phase. So you'll hear more about that later. But I want to thank you all for those comments, because that's very important. Zion, I don't want you to think I'm picking on you, but I want to make sure that you're included in the conversation. You have anything you'd like to share about that? And if not, that's okay too. We'll move on to the next question.
Oh, sorry, I was on mute.
Okay.
Oh, sorry, I was talking. I was going to ask if you could repeat the question because I kind of forgot about it.
Sure. In Baltimore, there's been a history of organizations trying to implement programs and coming up short. How does GBRICS compare to other projects that have come along in the past?
I could say honestly, by first including and wanting the youth voice, usually it's a lot of talk about like youth or just minorities, period. In Baltimore City without us at the table, because they don't see us as fit, but they're the ones who give us the lack of resources where we can't be. Well, I'm not going to say we can't be, but why they don't see us as fit, such as education and stuff. So having a youth voice, and then also like the others were saying, like the feedback, because you never really no nonprofit really asks for, oh, how can I do it better? How can I do this better? How can we keep this going? How, like, even at the beginning in the draw phase part of you planning, how can we make sure we're getting feedback, and how can we make sure that's getting reference to other youth? Like, you're starting early with the feedback portion. You're starting early with fixing the small parts about the mental health aspect of everything. So that just shows how over the 5 years you will be, how great GBRICS will be for Baltimore City when it comes to mental health.
Thank you. And the last question I'm going to direct to Pickett to kind of lead us off. What do you feel most strongly about regarding your experience?
I think for me, it is really, I go back to this story of this young person who lost their life to suicide. And it's just, and I think I shared this at one of the roundtables. It's like, man, if maybe if we had done this earlier or had 988 in place, maybe that story might be different. And then I think about all those young people that surrounds that young person. And I think we have to do this, right? We have to do this because people are hurting every single day. I see it in Market Center, whether it's active addiction or mental health crisis. Um, this is something that we have to do, it has to succeed. And I think that's the thing I'm taking away from it. Is like, this is our opportunity to create something that's going to help a lot of people.
You know, at almost 30 years as a human service professional, like you said, Samara, I've seen programs come and go. I've seen funding dry up. I've seen focus from state and local folks change. But one of the things is I'm a firm believer in you can never have enough tools in the toolbox. And I do believe that this is a toolbox item. And so as a member of the helping profession, we can appreciate, at least I can, appreciate having another tool that I might be able to turn to help an individual, maybe to help an individual get back with their family, maybe to help a family. But the bottom line is giving them an option, you know? And so as long as GBRICS does its part and it's responsive, it's going to be a good relationship with the helping professionals because we can appreciate having options that we can offer to the members that we work with.
And you know, it's so important right now, particularly in the LGBTQ community. You know, the behavioral health professionals here know the data better than I do, but you know, LGBTQ folks, particularly trans youth, are 10 times more likely to have suicidal ideations, right? And I just got to talk to you from personal experience. You know, it's Pride Month. And, you know, one of the things I do is attend Pride festivals across the state for Free State Justice. And the conversation has really changed from the beginning of June to this past weekend because of the recent Supreme Court ruling. You know, and I saw folks in communities that were happy and unafraid. And now, in a blink of an eye, we're seeing the fear come back, right? And that's for people who have felt safe coming out. And there's so many other folks that we forget about in our community that don't have that safe feeling of safety yet. And so therefore, they really need a system that's geared around compassion and understanding of themselves as individuals, you know, by peers. Otherwise, we're not going to save these lives. We need to do this to save those lives. That's the fundamental, you know, very foundation of this. That's what we need to do because these lives are at risk. And I would say they're probably more at risk now than they've ever been because of where this country is.
Yeah, I definitely agree with Tina. Connection. I just go back to that connection, connecting people with other people that understand, connecting people with other, you know, resources and providers that are helpful that they can depend on. Often, you know, you give a resource and they go to a provider and it's, you know, they can't take them or they can't, you know, so some follow-up to make sure they make that connection is important, you know, to make sure that they're getting the help that they need. But that comes back to connecting them with other families, connecting them with the school. You know, the school needs to be aware of what's going on. You know, I'm a big advocate for having, you know, the more mental health services directly in the schools, because that's, you know, that is like home base. You know, they spend more time in school than they do at home. And if they know and are educated and are, you know, around people that can explain things to them. They might identify an issue with themselves, a friend, their mom, dad, you know, a family member, and they can get help for them. So I think it's everybody's, you know, part to play.
Thank you. And Zion, I'm going to give you the last word, and this is going to be our last question.
Yep, and we have two questions for the panelists too, I think.
Okay,
before
should we
move
give
on.
Zion a chance to speak first, and then we can take the two questions from the
Sure.
audience? Okay.
I think for me, what I'm most I'm sorry, I'm not the translation, but what I'm most excited for is just simply having a resource available to us. Definitely since Baltimore City, I wouldn't say it's a poor city, but it's a under resource city, if that makes sense. So just having that resource to know that I have access to it, or the people around me have access to it, it just seems like it's going to help so much. Definitely the more you spread it, like into schools and things like that, or the ways that the focus groups or the roundtables have expressed, you should advocate for it or spread it. It just like, this seems really exciting, because it's just like, it's now taking the next step to help, because this right here is going to help so many other things, like youth being homeless, youth on the streets, youth violence, all of that, because there's been so much loss in Baltimore City. I'm sure everybody see, but it's like the ages get younger and younger. Like the guns do not care where it is. So maybe this is the answer to helping the youth violence and the people who are in need and who don't have the access or the money at home for the things that they need, that they really cannot control.
Thank you. Dan?
Sure,
Question?
yeah, and Zion, we had a question from the audience around reaching youth and how young people use different language and are experiencing different types of traumatic experiences, kind of like along the lines of what you were just mentioning. And the question is like, how do we use this one number and this one system that's designed to serve both young people and adults and older people? What do we need to do to make sure that this one system can reach young people who have different experiences and speak differently than some other community members?
Honestly, I think schools is going to be your top, and then like things like just different nonprofit organizations like Car Smile, Springboard. It's like a lot of organizations. Let's Thrive Baltimore. Having them reach out to you, say this, I have this research, I have this for you. And just reaching out, like go to places where you know youth are. And with having them places where youth are, then that's your main target of getting people to encourage other people to use it, such as youth.
Mm-hmm. Yeah, no, that's a great idea.
We have two questions too in the chat.
Yeah, we're going to hold some of the questions for the end. We just want to ask some questions for the panelists. You know, because just we still got a little bit more to cover, but I know there's one last question for Crystal around how families or loved ones who are impacted by a family member in crisis, what kind of services are available out there, and you know how does that relate to crisis response services like GBRICS?
That's a great question, and actually that's exactly what my position is with Maryland Coalition of Families, is that I connect with them as someone, not so much as a family peer support specialist, but a mom. I'm a mom that has lived experience. My children have lived experience. A lot of times I'll go to them and ask them for advice, but to more directly answer the question, it's really important to let the caretakers know that they're not alone, that there is help for them. We would encourage them sometimes, like they don't realize that they're going through their own trauma, having to deal with someone in crisis, and they don't see that. They don't see how much it affects them to be dealing with that. educating them on diagnosis, referring them to a therapist or a support group, and also doing trainings like parenting classes, de-escalation techniques. We can get them involved with all those things. So it is really important to make sure that these caretakers and loved ones and friends acknowledge their part and how they're being affected by it, and there are services for them.
Thanks, Crystal. And yeah, I think we'll hold the rest of the questions till the end of the webinar, Samir.
I just want to take a minute to just thank the panelists. I really appreciate you all coming tonight, taking the time to share your stories, and we really appreciate it. Thank you so much. And I thank the audience too for their participation.
You're welcome. Thank you for having me.
So someone's gonna bring us home to share a little bit about what's to come. You know, the panelists were all very heavily involved in helping us to organize our community engagement activities over the last year, helping to recruit participants and the roundtable events that we hosted, helping to get the word out, and we couldn't be more appreciative of them. But now we're kind of moving into a new phase with the initiatives that are funded by the GBRICS partnership, and you know, we've been doing community engagement for a year, so we wanted to share sort of what's coming next for the GBRICS partnership and community engagement. One of the big ones, like we mentioned already, is a 988 outreach and education campaign. And we're partnering with Marketing for Change, which is a communications and behavior change marketing firm. And we're using both market research and community feedback to craft this campaign. And community partners are going to be a huge part of it. We've mentioned it a lot already, but just as a reminder, what is 988? 988 is going to be the new 3-digit phone number for the National Suicide Prevention Lifeline. And that transition occurs July 16th. So that is coming up really soon. We think that 988 is going to make it easier to access these services in the moment when when people are often distressed and can't remember maybe a 10-digit number. And so this new number really represents a new opportunity to reimagine how to access these services, and to kind of put these services on the same level as services accessed by 911. And so we really identified promoting 988 and the services that you can access through 988 as one of the next key steps for community engagement, and that we hope folks on this call can help us with. Some of the foundations of our outreach campaign is the recognition that there is a lot of goodwill around a helpline. People see the value in this, and so that gives us an opportunity to build on that. Some of the key messages or key goals of the campaign are to help people feel more comfortable in knowing what to expect when they call, tailoring the behaviors or tailoring different strategies for different types of callers, and making sure that we do not over promise what we can deliver on. What this campaign is going to look like is it's a phased approach, and the goals of the campaign are over there on the left-hand side: destigmatizing help seeking, establishing 988 as a go-to resource, and increasing support for 988 and its services. And some of the strategies we're going to be using that we hope community partners can assist with and can access and to spread the word about are developing a website with education around the process, equipping partners with resources like flyers, one-pagers, magnets, other types of swag that folks can share at events or share with within their networks. We're going to do a paid search campaign with Google and other search engines. So people who are looking for these types of resources will be directed to our website. We're going to work on some local earned media around the transition. And then we will be having a webinar series a little bit later on in the summer to provide even more information about 988 and additional toolkits that are coming down the road. And so that's going to be a big part of the next phase of community engagement. This past year, we've been wanting to learn from communities. Now, like, that's going to continue, but we're also starting to want to really get the word out into communities in a very intentional way. One of the ways that communities can plug into this is through our community ambassador program that we're hoping to launch soon. The goal of the ambassador program is to build or rebuild trust with key communities by partnering with members of those communities. One of the key things that we learned through all of our community engagement is just how skeptical people are in certain communities of services such as this and new initiatives like this, and that people are going to remain skeptical unless they hear it from someone they already trust, like a member of their own community, like their pastor or their teacher at school or their neighbor that has lived in the neighborhood a long time. And so we want to work with those key leaders to promote 988 and help to reach those communities that we wouldn't be able to reach on our own. The way that we're imagining it happening, and we're just getting this off the ground. And so we're going to start with a pilot cohort of 20 to 25 leaders across the region, with some representing all 4 jurisdictions: Baltimore City County, Howard County, Carroll County. We are developing an orientation and training that we'll share over the remainder of the summer. And then we'll work with each ambassador to make sure that they have the support and resources they need to engage in whatever strategies they think are the right ones for their community. And then, towards the end of the year, we will kind of see how it goes and hopefully expand this program. And that's like kind of one key initiative for folks who really want to dive deep on 988 outreach and education. But there's a lot of opportunities for everyone to stay involved with our work. Folks, we have a general GBRICS email list where you can just get information about GBRICS. It's a place that we'll be sharing some of these outreach resources, one-pagers and materials, sharing information about the website when it launches, or local events where 988 outreach and education will be a component. And so we encourage people to sign up or stay signed up for those email alerts. And that's also where you'll hear about our quarterly forums, which is just a quarterly event that we host to give an update on where things are at with GBRICS, the GBRICS partnership. We hope that whether you or your organization is really engaged with work around the GBRICS partnership, we hope that everyone can help us spread the word about 988 and within your communities, if there are resources to download or social media resources or toolkits that are developed down the line, we hope that folks can help us with that. And we don't really know exactly what it's going to look like, but we're going to continue to have roundtables and other community engagement opportunities where folks can come together and let us know how things are going. 988 is launching next month, and then some of the services that we mentioned at the top, the GBRICS partnership is helping to support, are going to be launching later on in the year. And so we're going to want to hear how that's going. And there'll be formal formal pathways to share feedback, but we also want to host events and more informal community opportunities to just continue to share your perspective and any experience or ideas that folks may have. Lastly, if this has piqued your interest and you haven't been engaged in our community engagement committees yet, we encourage you to contact Samira about joining your local community engagement subcommittee. We have one for each jurisdiction. Her email address will be at the end of the webinar, and we're always, we always welcome more participants in that. The last community engagement opportunity that I'll mention before we wrap up or answer additional questions about GBRICS is the Fund Maryland 988 campaign. Carlos was mentioning about sustainability, and he's absolutely right that we don't want to build all these services and do all this work and get the word out about this new access point, and then have it dwindle after the 5-year grant comes up. And one of the biggest ways that you can make a service sustainable is through policy and advocacy. And so we have another coalition, which is called the Fund Maryland 988 campaign, that is pursuing sustainable funding for 988 helplines, like the ones supported by the GBRICS partnership, as well as other services that are important to crisis response. We had some success this past year in Annapolis in getting some funds allocated in the budget for this coming year. And that's great, but there's still no sustainable, ongoing, dedicated source of funding to support this beyond the 5-year grant window. So we'll be working on that, working with elected officials, working with community partners to come up with strategies on how to do that, and encourage folks to join that group as well. The website is up there, and that work will start to ramp back up again after the summer as the 2023 legislative session starts to come into view. So those are some of the opportunities coming up to stay engaged or get engaged with the GBRICS partnership. And we'll pause and see if there's any other questions before we wrap up. I know I did see a question in the chat around whether services are available for people with dual diagnoses, with mental health and substance use challenge or conditions, and that varies a lot from one program to the next. And I think the questioner was right in that a lot of programs are not set up for the dually diagnosed, even though that's very common for folks who are having challenges related to substance use to also have mental health challenges, and vice versa. For the services that are supported by the GBRICS partnership, the call center and the mobile response teams, and some portion of the open access appointments, those will serve folks with either or both mental health or substance use disorders. So can't speak for the rest of the system, but that is definitely something that is important for the services supported by the GBRICS partnership. Another question that we saw is whether these services or whether the GBRICS partnership is engaged with immigrants. And absolutely, the panel that we brought together, we wanted it to be a manageable number of folks, but we have close partnerships with a number of groups that work with immigrants, both community, like local neighborhoods, like in Southeast and South Baltimore or Baltimore County, as well as the Immigrant Outreach Service Center helped to plan and organize one of our roundtables. So shout out to them, and we will continue to engage with that community and incorporate kind of the unique needs of someone who may be a recent immigrant or maybe a refugee or maybe undocumented or have English not be their first language, that those communities need kind of tailored responses, and we want to continue to engage with them as well. Then I think there was one other question. Yes, whether the GBRICS partnership is engaged with what's happening in other states, and absolutely, I think the GBRICS partnership is, the level of funding and the amount of time and the amount of local support that we have is a little unique. I mean, not totally unique, but this is a pretty significant initiative that we're working on here. But we are also talking to colleagues in other states. There's a weekly video meeting put on by the Crisis Now folks that you can sign up for to get on their list and to join that meeting. It's every Wednesday at noon. And that's a big national group with 200 plus people every week talking about different efforts to reform and strengthen behavioral health crisis services. And I think we are just in a really interesting time where this feels like the idea that we need an alternative system to 911 and emergency rooms and law enforcement to serve people experiencing serious emotional distress or other types of behavioral health crises or suicidal crises. There is now broad recognition that we need a separate system for that, and that the systems that are in place today need to be strengthened and funded more adequately and reimagined to be able to be more accessible. And so it can sometimes feel like we're a part of a movement, because many states are working on this issue. There was funding included in the recent bipartisan gun control bill that I think passed, or at least is on the way to passage in Congress. So that's interesting to see. And I think we look forward to continuing to learn from their experiences and to share our experiences with them. And folks, are there any other questions for me or for other panelists that are on the webinar? I see one more question here. I'll kick that one to Shauna if she's here, and that's the question is whether there are already staff that are providing these types of services or helping, or kind of where we're at in terms of actually having being able to provide these services to residents.
Hi, can you hear me okay?
Mm-hmm.
I'm not sure what the question is. Are there existing mobile crisis teams in the existing call center? I guess that's how I would interpret that question. So I would say yes, that is, there are existing teams, there are existing call centers. We're trying to make the services more timely, more available to everyone. So we're trying to kind of expand the services that are already there, as well as improve the quality and improve transparency around the services. So I hope that answers the question.
Yeah, thanks, Shauna. Yeah, and it's an important thing to emphasize that 988 is coming next month. GBRICS partnership funding is going out to support new services later on in the year, but there are lots of services available to people now. So if somebody is in need, then we definitely encourage you to call that 10-digit 1-800 number that we mentioned earlier, 1-800-273-TALK. That's the existing number to access the National Suicide Prevention Lifeline, or to dial 211, press 1, which can also connect you to a Maryland local call center. So we do want to underscore that we're building on the system that already exists, and the system that exists provides excellent services and has saved a lot of lives. But we're just trying to augment and systematize it and standardize it more through these services. I'm not seeing anything else in the chat. Samira or Gabby, is there anything that I missed in there, or any other questions that we didn't get to?
I think that's all the ones I see.
Yep. All right, well, we really appreciate folks sticking with us for almost 2 hours. We really welcome everyone's interest in this work. Please don't hesitate to reach out to Samira or myself, but particularly Samira if you want to get involved or plug in a little bit more into these community engagement efforts. And Samira, do you have any closing thoughts before we wrap up?
No, I just want to thank everyone for attending tonight, and to our distinguished panelists for their time and effort, and our presenter, Shauna, as well. And Gabby Thacker for helping us. She is the behind the scenes person tonight, and we couldn't have done this without her help. That's it for me.
Absolutely. Yeah, well, thanks, Samira, and have a great evening, everybody. Thanks for joining us.